There are 4 tendons and muscles that make up the rotator cuff, and they help rotate the shoulder, and they actually form a cuff over the ball of the shoulder. So in this model, I've taken away the deltoid, which is the big muscle on the outside, so that you can see the tendons of the shoulder. And these have kind of torn away. There's 2 tendons that come up from the back, there's one that comes across the top, and there's one that comes across the front. The most common tendon that tears is the supraspinatus tendon, and that's the one on the top. The second most common, I would say, is probably the subscapularis tendon, which is the tendon in the front. Most rotator cuff tears that we see and treat are degenerative. They happen from time and age, not from a single tear or a single event. So it starts small and you might not even notice it. It might not be symptomatic. As the tear gets bigger, it becomes symptomatic, or an injury happens, and then we obtain an MRI, and then we see the tear. A smaller percentage of patients have an acute single injury that causes a tear of the tendon. In that setting, those folks almost always need surgery to fix the tendon. The degenerative tears, sometimes we can treat those conservatively with an injection and physical therapy. It really depends upon the patient age, the nature of the tendon, how repairable the tendon tear is, and also your needs and expectations. So when we decide somebody needs a repair of a rotator cuff tendon tear, generally speaking, we repair these arthroscopically. So arthroscopic, arthro is joint, scopy, camera. So to do the repair, we make some small incisions around the shoulder to put tubes in the shoulder that are about the size of a pen. Through multiple tubes into the shoulder, we can put a camera and tools into the shoulder that we'll use to repair the tendon. The tendon is torn from the bony attachment. So my job is to stabilize and repair that tendon to that bone and stabilize it there. What happens next is, over the ensuing months, the tendon and bone knit back together and heal. There's not a lot we can do to speed that process up, but there are things you can do that slow it down. So then we have to be careful with what we do after the repair. Anything that causes activation and stresses that tendon, that's going to increase tension on the repair, and that's not what we want. So for the first 6 weeks after surgery, we'll do just gentle passive movements. At the end of 6 weeks, we'll start active movements, but with some assistance. At 8 weeks, you can do full active range of motion. By 10 weeks after surgery, we'll start light strengthening.